Hello, everyone, and welcome to week 6, treatment of trauma part 2. This week, we're going to be talking about steps 3 and 4 of treating trauma and other options such as advanced trauma treatments. You may want to open up 2 windows for this presentation. So as I talk through some of these different techniques, I also have linked videos in Canvas for you to pause the mini lecture and go into those videos and watch that overview before you come back and finish or go on to the next part of the lecture. So that might be something you want to do now. And first, I thought we'd start with a quote: "Transformation isn't sweet and bright. It's a dark and murky, painful pushing, an unraveling of the untruths you've carried in your body, a practice in facing your own created demons, a complete uprooting before becoming," by Victoria Erickson. And on our agenda for week 6, we are going to talk about step 3, helping clients learn to express their inner experience. Step 4, integrating the senses. We are also going to talk about advanced training techniques and other considerations. This is going to cover, this one mini lecture is just going to cover step 3 because it is a rather long portion, and then I will record another video for the rest of our agenda for this week. So, expressing the inner experience, we're going to talk about emotional processing for trauma. And when we talk about emotional processing, the goal is to know what you know, feel what you feel, learn to communicate both, and also you can use creative interventions to help with this. So what is emotional processing? I have a couple of different points here for you. But the overall idea is that you take your perceptions, beliefs, and expectations around the trauma, and you think about how those activate fears when you are in the trauma and maybe since that trauma has happened, but you're going to re-examine them through a new context. And the new context is in relationship in the counseling process. So this is based in cognitive processing, looking at old thoughts and reassessing their suitability in a new situation, but it's a little bit bigger than that because we're going to talk about emotions and beliefs specific to the trauma. Your client does need to be able to ground themselves and be ready for this kind of work. It can be rather difficult. So you want to make sure that you've done the first 2 steps and they're in a good place for you to move forward. Your client needs to be ready to revisit the fear and the trauma and everything else that comes with thinking about or bringing up the memories of the event or events. Oftentimes, and one thing that's important to remember about what happens around traumas is that the beliefs and expectations and thoughts that come out of that are misinformation that we have taken in, and then because of our brain's inability to contextualize the information, we don't know what to do with it. And so things that we once thought were safe, we now perceive as unsafe, even though they may be, or vice versa. And so your client is going through life viewing life through a faulty lens. They're viewing life through a trauma-based lens instead of maybe the lens they had before, or a lens that can contextualize between different situations. And emotional processing will allow your client to revisit those perceptions, beliefs, and expectations, but in a safe environment with you. And hopefully through reassessing them, they will be able to come out the other side and form new perceptions, beliefs, and expectations. So the first step to emotional processing is to begin with some sort of exposure to the trauma. And so you could ask the client to think about it or describe it to you. And you may want to break it into smaller pieces so that it's easier for them to work through. But essentially, once you've decided on how you want to start and what you want to cover for this specific emotional processing session, you will have them describe the event or think about it in detail. And then you want to walk them through some of these prompts. So what are some of the triggers that are associated with the memories? And And then what are they triggering? What emotions are these items or things, thoughts, feelings activating through thinking about the memory? After that, you of course are in a safe setting, so you are not going to reinforce those fears, right? Instead, you're going to talk to the client about, okay, you're thinking about this event and it brings up an intense fear of being unsafe. However, you are safe right now. You are in this session with me. If you're in a physical location, you could describe it. This is a good place to do a quick grounding activity to reinforce the idea that they are in a safe space right now. And by doing that, you counter condition the reaction from the fear to a feeling of safety. And over time, the goal is that the original link between the memory and the emotion is extinguished. And so it is a type of conditioning, right? But it's focused on the emotional response that's brought about from the triggers. So I'm curious for you all, what do you think is the healing mechanism in emotional processing? And maybe there are multiple answers to that, but I'd like to know what you think. So how does emotional processing work? The intrinsic processing that happens when a client re-experiences a trauma can be a part of a re-traumatizing process, which we've talked about before, right? The brain is trying to figure out what's going on, but it's having flashbacks and nightmares and intrusive thoughts and things that you feel very out of control on. And so the brain has a really hard time making sense of that information and then also helping your system to calm down. So it's almost like it's on overload. It just can't figure it out because too many things are happening at once, and all of the chemicals and hormones that were released during a trauma that may be released again when some of these things occur, especially nightmares, flashbacks, things like that. So emotional processing is a good way to step in to help the brain do a very guided intrinsic processing. And through talking through the event and the emotions, and then talking about and helping the client feel safe, helping them recontextualize, allows for titrated exposure to the trauma material. And that's why I said earlier, you're probably going to want to break this up into predetermined, aspects of the trauma, timeline, things like that, so that you're taking it like basically one bite at a time, one small bite at a time. And so that the client has time to process what they're thinking about and what they're learning and the new feeling and get used to that before moving on to another aspect of it. And there is a balance that needs to be found in doing this type of emotional processing. It's called the therapeutic window, and it's alerting your system or the client's brain enough that they're able to improve their well-being and process some of the trauma, but not so much that they get overwhelmed or flooded and they start avoiding. And so we're always working towards that therapeutic window. There are ways that you could and should inquire with your client about if you are hitting that, therapeutic window. It could be questions like, was there any point today in our session where you felt overwhelmed or flooded, or you felt a somatic response in your body? That would probably lean towards maybe overshooting. Or, did you feel anything? Or were you was the activity kind of a nothing burger? And if that's the case, then you're probably undershooting. And so undershooting is when you don't use enough of the trauma material. You're really validating, you're really supportive. Maybe you're doing a ton of grounding, but you didn't bring up enough of the trauma material. It's not dangerous, but it's also not going to help your client. And then overshooting is when you do too much too quickly. And so that's why you really want to go back to this, let's figure out the pieces of this that we're going to work on and in what order. So overshooting, can very much overwhelm the client. It can cause them to take a step back from counseling. It can also happen through not enough processing. So maybe you you jump right to grounding, or you jump right to, helping the client feel safe instead of processing enough of the material. But unfortunately, if you tend to lean towards overshooting, it can create more disassociation and avoidance behaviors, and the client could, I think it could bring a lot of harm to them. It could be an increase in intrusive thoughts or nightmares. It could also lead to higher dropout. So here are the components broken down again for you. The first is the exposure. So having an activity predetermined, either written or telling or thinking about a specific aspect of the memory of the traumatic event, bringing up, activating those emotional responses to the memories. And then also you can ask about, and what are the automatic thoughts that come with that as well? So that helps you dig a little bit deeper. What are the feelings that come up? And then also what are the automatic thoughts? And then the third step is really where you get more involved to help the client realize that first, they're safe in the counseling session and with you. And second, they are safe from being overwhelmed. They can handle these emotions. And it's really a good time to have them say those things out loud. You can use open questions. You can use your basic skills, reflection of feeling, summaries, and then lead to them talking about how they feel when they open their eyes and they see that they are in a safe place. So they're reconditioning themselves, and then you are also helping to reinforce that reconditioning. And then next, you're going to do some counter conditioning. So introducing some of the positive associations. This could be through relaxation activities or mindfulness. You could talk about emotional release and what's helpful for the client to feel catharsis, and engage in some of those activities. And then next, if everything goes well, you'll reach the desensitization and resolution phase, where that connection is broken between the trauma event, the triggers, the emotions, the thoughts, and they're replaced with the new stimuli. So hopefully that makes sense. Once again, this is a process that's rinse and repeat, right? So you're going to do this in bite-sized portions for different aspects of the trauma, and you're going to repeat it as many times as necessary. So emotional processing could take up a good portion of the time that you spend in session for many, many weeks. There's no timeline for healing trauma, and everybody will react differently. But this is one way to help the client become more centered and feeling more control of their thoughts and emotions around the trauma. So this is just a short activity I'd like for you to engage in if you are comfortable. So think of a time you were afraid or even traumatized. However, please try to think of a time that's in the past or that you don't feel as reactive to. What event was occurring at that time? And if you feel safe, tell yourself the story of that event. You can even pause me now if you'd like to do that. After you have told yourself the story of that event, ask yourself what triggers are or were associated with it, and what emotions are brought out by those triggers. Feel free to pause again. And now thinking about where you are when you're watching this video, maybe at your home, at work, in your office, your kitchen, wherever you do your homework. Are those emotions still applicable in your current context? And if they aren't, what feelings are appropriate right now? And now try to keep your current feelings of hopefully safety wherever you're doing your schoolwork in mind, and think about that event again. And it can even help sometimes to have a reminder of where you are in the present moment and that it's a safe place. So, if there's something that is meaningful for you, you could hold on to it. If you are in your office and you have like a favorite pen or something else, maybe your water cup you could use as a grounding device. So anything that kind of helps you stay feeling and that moment of safety as you retell the story. Feel free to pause again to do that. Okay. So I'm wondering, and feel free to share this with me if you'd like to. I'm wondering what that was like for you all. And if you felt a difference, if you were able to hold on to your current feeling when thinking about that event, or what you noticed going on in your body, both in the first time that you told yourself the story and the second time. That is a very small activity to illustrate what a client might feel like during an emotional processing activity, but I think it's helpful for us to have some idea of what it does feel like to do this type of work before we engage with clients in it. All right, and then in addition to emotional processing, another set of approaches that you could use in step 3 are creative approaches. You did learn a couple of weeks back about how trauma affects the brain, specifically the Broca's area where we create language, and how that can be limited after a trauma due to multiple factors, including memory misstorage and the other impacts of hormones being released in large quantities on our brain. So sometimes a great way around that is to use creativity. And I listed a few here, but this is not an all-inclusive list. So you could use Gestalt experiments if you like Gestalt therapy. You could use aromatherapy. You can use poetry. Sand tray is one of my favorite types of creative approaches to use. I will say you only want to use sand tray if you're trained to do it, because there is a bit of a technique to it. And so I'm not sure if it'll be covered in the child and adolescent course, but I'll try to do a training on sand tray, probably a synchronous training that I'll offer before all of you graduate. So sand tray is really good. Narrative therapies can be helpful. And I also really enjoy using music therapy and music chronology and treatment with trauma. And it just depends on what the client is into. So if they like music, that's a natural match, right? And so you could give them prompts like, play me a song that, you feel like resonates with your life right now. And play me a song that relates to how you would like your life to be. If they are a musical person, they write their own music or they write their own poetry, having them do some of that. Or art as well you could use, and creative approaches. I had a client who I was treating both her and her granddaughter. Her granddaughter, she's the non-offending caregiver, and her granddaughter had been abused by her husband, soon to be ex-husband. And when I was treating the grandmother, she brought up a creative activity I had done with her granddaughter around a self-portrait. And when I do a self-portrait drawing with clients, I always tell them this isn't about your artistic abilities. What I want to see is how you are viewing yourself right now. And so it doesn't have to be an exact drawing of your face or your body like a self-portrait typically is. It can have symbols in it. You can use metaphors. You could be as creative as you want. And so the client, the grandmother, wanted to do the self-portrait as well. And as I talk through this, I feel like I've talked about this already, so apologies if I'm repeating myself, but she drew a really just impactful self-portrait of, one side of her face was, she was smiling and portraying like a calm sense, and then the other side of her face, she described as falling apart, crying. And so it really led to a great discussion on how she feels like she needs to be strong for her granddaughter, make these important decisions. She's now the sole provider, like that, having to put on that, responsible adult face. And then the other part of her was the part that was falling apart, that felt betrayed by her husband's actions, that, felt overwhelmed at all of the things she now had to do on her own. And so it was a creative activity, but it led to a great processing discussion of how much turmoil she was having within herself. And the drawing helped her get that out so that we could discuss it further. So lots of different ways you can use creative approaches. If this is an area of interest to you, the Journal of Creativity and Counseling is a great read, and you can find a lot of their articles either in our library or through interlibrary loan. And then of course, there are also books written on creative approaches to trauma. So again, if that's an area of interest for you, it might be something to look into. All right, I am going to stop this mini lecture here, and then we will pick up the next one on step 4. Please feel free to take a break, stretch, or do whatever you would like to do.